My name is Brady Kirkman, Executive Director of Marketing and Business Development, and thank you for joining us with The Pulse. Today we have with us Lacy Krueger. Hello, Lacy. How are you?
Hey, hi, Brady. I'm good.
Fabulous. So tell us, what is your role here at Windom Area Health?
So here at Windom Area Health, I'm the Cardiac Rehab Coordinator. So I have patients who have had a heart event or heart surgery, heart failure, some kind of heart diagnosis. And then I work with them, having them exercise while wearing a heart monitor and checking their vitals before, during, and after exercise to make sure everything is looking good. I'm kind of the bridge, I guess, between the patient and their cardiologist or primary. If something seems alarming or that they need to be notified, I'm the one who gets to pass that information to make sure further action's taken.
And you've been here 3 years?
Yes.
Fabulous. Well, it's great to have you part of our team here as well.
Mm-hmm.
So you talked about a little bit about the cardiologist, and your service lines are a little different because they have to be referred to you by an MD. Is that correct?
That is correct. Mm-hmm.
So you talked about that. Go a little deeper into the regime of what a patient would experience if they're getting your services.
Yeah, so their initial eval is a little different from everyday sessions. When I first meet them, we go over diet, stress, at-home activity level, and we do a walk test. But then on a regular basis, I have them always wear the heart monitor while they're here. I check their blood pressure and their heart rate before, during, and after exercise. If they're diabetic, I also check their blood sugars. And I also see their heart rhythm with the heart monitor.
Okay. And, obviously it's not a one-size-fits-all. So how many sessions or how many times would a patient have to come and see you potentially?
Yeah, that's a really common question patients have, and it varies depending on patients' abilities as well as how their heart is adapting post-surgery or post-heart events. So it can range anywhere from 12 to 15 to the most I can ever see them is 36. And we meet 3 times a week as long as there's no holidays or weather. It's Monday, Wednesday, and Friday for a little under an hour typically.
That was just going to be my next question. You read my mind. How long does the patient's appointment usually last here? And so a little less than an hour.
Yep.
Okay. Well, you talk about those 36 sessions, at the max. After that patient is done, are there follow-up services or is there anything a patient should be aware of after that?
Yeah, for sure. So when they graduate cardiac rehab, there's a couple of things that I discuss with them before they are all done. One is their diet and exercise plan for after, and I typically give them a free month to the wellness center here. And I kind of explain how, if they never know what to do or how to use a machine, the help that the wellness center staff can provide them. And then the goal is for them to take the habits they implement while they're in cardiac rehab for when they graduate so they can continue to live those healthy lifestyle choices.
Well, and you mentioned the wellness center. In just a matter of months, they will be moving into a brand new facility as well.
Mm-hmm, very exciting.
Top floor. I just got a sneak peek of it last night, and I tell you, it will be really nice to see that when it's all, come to transition and process. What are some of the advantages, after a patient goes through your sessions? What can they expect from that?
So the advantages of coming to cardiac rehab, basically a lot of patients have a lot of hesitation and are intimidated by what they can and cannot do. And so cardiac rehab ideally gives them the confidence to understand their abilities and be able to do more for themselves. That's really kind of the overall goal for them.
And I'm sure, like anything, getting into a facility or a treatment, there's some apprehension there.
Mm-hmm. Yeah. So once they have that initial eval, and usually after a couple of weeks, they really gain more confidence in themselves and they can see, hey, I can do this, or I should be exercising while I'm at home in addition to here. It's really good to see.
Well, excellent. Well, Lacy, I really appreciate you joining us today. If they need to get a hold of you, how can they contact you?
So they can just call my direct number, which is 507-831-0642.
Perfect. Well, Lacy, thank you for joining us today on The Pulse, and we'll see you next time.